Okay, so here it is, the top 5 things that you want to know about labiaplasty. So the first thing that everybody wants to know, that everybody is super concerned about, is it painful? And the answer is not really. The procedure itself is fairly straightforward, and there's a series of things to be done to make sure that it's not super painful for you. So you get numbing cream, oral sedation, which makes you super loopy and you're kind of all out of it. And then you also get the world's tiniest needle to numb up the area. And by that time that happens, you don't feel a single darn thing. And then in terms of afterwards, you're given pain medication. So it's super comfortable and pretty well tolerated. Number 2. How long does it take? The procedure itself, with the actual procedure of trimming down the tissue, can take anywhere from 30 minutes to about 45 minutes. But in the doctor's office, when you go in, it's going to take about 2 hours, which is basically having you sign forms, getting you comfortable, making sure that your medication kicks in, then doing the procedure and cleaning everything up and getting you comfortable to go home. So expect to spend about 2 hours there. So, number 3, what is my recovery going to be like? You will need to take off a few days from your super busy and super active life. What does that mean? That means that if you can work remotely, great, you can be on your laptop at home, but you're gonna need to really be at home with your legs up and with an ice pack in your underwear to help with the swelling and the discomfort, and then just have a lot of things lined up to be able to keep you mentally active. So overall, for the first week, the most discomfort that you're gonna have is the first few days, and then it gets better by the first week. And then thereafter, about week 4 is when you can start doing heavy activity, and week 6 is when you can engage in sexual intercourse. And here's the next question, number 4. Does it change my sensation? No, a labiaplasty should not change your sensation in any way at all. All of your sensory nerve endings for all of that good stuff during sexual intercourse and pleasure comes around the clitoris, and we are not going near that area during a labia minora reduction. Some people need a little bit of extra tissue taken out from around the clitoris, and we're very careful about not removing the tissue of the actual clitoris, so it should not change your sensation. And last question, number 5, how will it look? Well, honestly, that really depends on the look that you're going for. So you're going to have a discussion with your surgeon about what you want it to look like, what you're hoping for it to look like, and they will guide you through if that is an appropriate expectation and what you should be able to reasonably obtain from the procedure. Some people want more symmetry, which is really challenging to do. Some people just want it to sit behind the labia majora, which is fairly straightforward. Make sure you ask all your questions. Make sure that you feel incredibly comfortable with your surgeon and that it's the right thing for you to do. Never feel that you're being pressured into it. Remember, this decision is about you and your body alone, and you have all the opportunity in the future to ever get it done if now's not the right time, or enjoy your anatomy exactly the way it is. All right, guys, let me know if you have any other questions. Take care.